Hi, my name is Jacqueline Pegram, and I'm presenting my project on pain management in neonates. So the clinical nursing problem. Pain is not always managed in neonates. Pain, if it is managed, may not always be managed correctly. There's also lack of education on pain management in neonates. People don't always believe that neonates feel pain, but they do. Pain is not assessed correctly. And lastly, pain management is not documented even if it is implemented. So background and significance. Nociceptors, or pain receptors, develop as early as 20 weeks gestational age. Neonates experience pain regularly after birth. Painful stimuli can cause abnormal long-term neuroendocrine and immune responses. So just think that healants that we do after birth might affect our kids for the rest of their life. Prolonged pain can cause changes in the structure and function of the nervous system as it is developing. So neonates that are born in Kentucky experience many painful procedures. Shortly after birth, neonates experience a vitamin K injection. They experience many helances in order to collect labs, a state screen, and monitor the glucose levels. And let's not forget about our little boys and those dreaded circumcisions. So synthesis of research. Breast milk and sucrose have proven to be very effective in managing pain, although sucrose has proven to be more effective than breast milk in managing pain. Sucrose or breast milk should be given approximately 1 minute prior to the painful procedure in order to have the best effect on the infant. Volumes between 1 milliliter and 5 milliliters had similar results in managing pain. Little research has been done on infants less than 32 weeks. So the purpose. The purpose of my project is to modify the pain protocol at St. Joseph East. My goal is to educate staff on pain management in neonates. I want to educate the staff on how to assess pain, how to use our FLAC scale, which is our pain management scale that we use in neonates at St. Joseph East, when to manage pain, how to manage pain in the use of breast milk as well as sucrose, and where to document the pain management techniques that are utilized. And lastly, I want to educate them on the changes to the protocol. The changes to our pain management protocol in neonates that I am making are the use of breast milk as well as sucrose for pain management, and to assess pain every 4 hours rather than every 8 hours. So implementation. I presented my material at the education fair this past month as well as staff meetings. I educated staff on the overview of the protocol changes, how to assess pain using the FLAC scale, when to assess pain, how and when to give sucrose or breast milk, explain when to assess pain after sucrose or breast milk, and then show staff where to document pain management once it has been used. Here's the poster that I presented to staff. In order to evaluate the project, I looked at, are nurses documenting pain management? Are they managing pain? And how are they managing pain? So I looked at all those things. I had the manager look at it, and we noticed that more staff are documenting pain management. Some staff are using breast milk, not all. Some are still using sucrose. Some are not managing it at all. But more often than not, they are managing pain. And then I also looked at the documentation of the assessment of pain. Are nurses accurately assessing pain? So I noticed that more nurses are managing pain and documenting it. We recently had a joint commission survey where we found that very few nurses were documenting pain management. So my nurse manager was very pleased to see that more nurses are documenting the actual pain management in neonates. Some strengths of the project were I presented the material during a time in which our unit had a low census, which was awesome because it's a lot easier to implement a change when you're not as stressed and worried about time management. I educated staff on the change in the protocol, which worked out well because if they have any questions, they can go back and refer to that protocol. Lastly, I left a poster in the staff lounge in order for nurses to continue to be educated on the information, and if they have any questions, that is also a reference point. Some weaknesses of the project implementation where I presented at staff meetings and at the education fair, which a lot of material was presented at once and a lot of changes were being made at once. So I kind of wonder if it would have been more effective if I would have presented solely rather than with all of these other changes happening at once. And then lastly, I presented after working 12 hours. I presented in the morning and in the afternoon. Many of the nurses were night shift nurses. They were extremely exhausted after working all night, so it became a little troublesome when they're trying to listen and pay attention and stay awake. Here are my resources. Thank you for listening.